I'm Dr. Hootan Zandifar. We're in my office, Beverly Hills, California. Okay, we're gonna go in here. Come on in here. All right. I'm gonna have you have a seat here and then give me your bag and everything. I'll put it there in the corner. I'm by training a facial plastic and reconstructive surgeon. So I do all types of cosmetic and reconstructive surgery for head and neck. I'm gonna have you hold this up here if you don't mind for me. I don't do anything in the body, but anything above the shoulders, that's my realm. One of my specialties, one of my areas of interest is in hair and hair restoration surgery. If you think about it, hair is a piece of identity. When they lose their hair, they feel like they've lost some of their identity. Think about it. Hair can define gender identity. The way hair grows in men and in women is different. Hair can define racial identity. Different races have different types of hair and different quality of hair and different expectations of what their hair should be within their part of society. So hair is really important in defining identity, and hair loss can go to the core of that. This is why hair loss is such a touchy subject. You know, men that lose hair feel less masculine. Women that lose hair feel less feminine. These are really important topics that should be openly talked about and openly discussed, because there are many solutions to hair loss, not just hair transplantation. There are medications, there are topical treatments, and injections. There are many solutions to hair loss that people who are suffering from hair loss don't have to suffer. They can have a solution for them. And you're gonna lay down, and your face is gonna go into this little donut hole. If you want, you can, when you're laying down, take off your mask so you can breathe better. Okay. Because it's gonna be like really hard to breathe with your mask on and everything. So go ahead and do that. We have a 40-something-year-old female today who, after her pregnancy, lost her eyebrows. It can happen. There's some hormonal changes that happen during pregnancy that can sometimes affect the growth of hair cells. And in her case, they didn't come back. In most cases they do, but in her case they didn't come back. And it was specifically targeting her eyebrows. Now she's been bothered by this since then, and it's been 10 years or so. And what she's done is she's gotten it permanently tattooed and microbladed multiple times. She was tired of doing that. She didn't want to do it anymore. So what she decided to do was to see if there was a permanent solution to her eyebrow loss. And sure enough, there is hair transplantation, and that's what we did for her today. This part of your neck has a lot of good hair for eyebrows because it's got like those little hairs, the one by ones here. Let go for a second. On the day of the procedure, you come to our office and we either have you shave a certain portion of the back of your hair, or if not, we'll shave it here for you. Should be perfect. You don't need any more than that. Then we'll lay you down on your face in one of those massage chairs with a donut hole, and we'll clean and numb the area of harvest. And that's the area behind your scalp. Schmutzy, so you put on it down. sterilizing solution so that we can sterilize the area. So by shaving, we can see the individual little hairs coming out, and that really is the reason why we did what we did, to be able to see all those little hairs coming out. Now we're going to outline this. If you don't mind, I'm going to go over there for a second. So let's sterilize the little area, okay? So you got a little shaved back of the head. Now let me know during the process if anything is uncomfortable, painful, or just you want to change anything, okay? But next step is going to be a little uncomfortable because I'm going to use the numbing medication to numb this area, okay? So you will feel the little pokes. I apologize. There isn't really much I can do about that part. Okay. Sorry. Poke and a burn. You're doing great. Poke and a burn. Poke and a burn. So each hair can have, each follicle can have anywhere between 1 to sometimes 5 little hairs coming out of it. For eyebrows, we really want the one hair from per follicle, because that's the best way to get the right shape of the eyebrows. The back of the head in this area of the neck gives us a lot more of that than further up. Are you doing okay?
Yeah.
I'm sorry, I know this is the least comfortable part of what we're doing. Sorry. This is just the numbing coming down, okay? You'll let me know if anything I'm doing is bothering you, okay? Okay, I think I'm done with numbing. All these areas should be pretty good enough. So we'll wait a minute for that to work. And while we're waiting for that to work, I'll just set a few things up. And get rid of these guys. So we're going to turn this guy on. I use a device that's a follicular unit extraction device. The company that I use here is by iBrain Robotics. It's the Hearts Mini System. What it is it's a suction device with a punch, which is kind of a circular blade, and a motor. The motor makes the circular blade rotate, and the suction will suck out the follicular units. And what we'll do is we'll just put that over the hair follicles and then turn on the motor, go down and come up, and then suck the little hair follicle, and it goes into a canister. So that's a hair follicle, hair coming out of the skin, and then the little shafts, bulbs at the end, are where the hair grows out of. Those are what we're going to implant. You can see the little hair is traveling right through the tube. 7.5? 7.5. And in these little holes, there's hair in between them. It heals without any noticeable scar, and the hair that grows in between them completely covers it up. So this technique is called follicular unit extraction, because we're extracting the hairs one little follicle at a time. Now, there used to be a way to do a hair transplant where it was called the strip method, where you took a strip of hair out and then you cut it up under the microscope into individual hair units. It's still done for some cases, and some people prefer it, but this technique's gotten a lot more popular because the recovery is better and the procedure is cleaner, and you really don't have any scars once you're done with it. So we were anticipating maybe close to 200 hairs for her. Some of these already have more than one. I can see they already have more than one hair on them. And we're close to number 50, so we're doing good time. It's just a small, kind of a tedious, delicate work, hair transplantation. It's you want to be gentle with the hair follicles. You don't want them to be damaged. So it's important to be gentle with them. And the process just takes time. So scalp is has a lot of blood flow, because hair follicles, pretty much each hair follicle has its own blood flow. So scalp in general is got a lot of blood flow, and in men, beard areas have a lot of blood flow. Now, hair transplant is interesting. In her, we're doing eyebrow transplant, but you can technically transplant hair to any part of the body that you want. So you can do beard hair transplant. You can do Eyelashes.
Sideburn.
What?
Sideburn.
Sideburns, yeah. Sideburn hair transplant. So technically anywhere you have hair, or you don't have hair and you want hair on your skin, you can technically transplant hair. And usually you'd get it from the scalp because it's the area that has the most amount of hair to give. And in that case, it's the area that gives you the best quality of hair too. Generally, we transplant hairs from the back of the scalp to other parts, partially because the hairs in the back of the scalp tend to be stronger. But also in men, the hair in the back of the scalp don't respond to men's hormones, the testosterone hormone, the same way as the hairs on the front of the scalp do. Okay. We've taken all the hair we need. I'm just taking some extra so that we have extra in case we need it. Some more. Good God, it's good. Hold on. Let me just do one thing. All right, so we're done harvesting. I'm just making sure we got all the hairs that we harvested out. Perfect. Okay, I'm just gonna clean you up. Just a little cold saline here, okay, dear? Just a little cold saline. That's good. And then there is a scissor there on that thing. I'm just gonna cut this in half.
Okay.
And then put one there and one there. Just gonna put some ointment on this stuff. On these spots. Yeah, do you mind cutting this in half? And then some gauze to put on top of this.
Okay.
I'll clean up. I may need some of it, but I'll clean up that up for a second. Okay, can you help me with her hair, however? Pull her hair up. Thank you. You can sit up. You want to? You can sit up. All right, I'm gonna fix this up. You can put on your mask if you want. Okay. This is gonna come up here. It's like a headband for you. Just keeps pressure over there. We'll come over here. And there. Okay.
Okay.
For now.
Any water or anything?
After we're done harvesting, then we'll take the hairs in the canister, we'll empty the saline, we'll separate the hairs, put them on a separate petri dish and on top of ice. We keep it on ice because, again, that keeps the hairs happy. They just kind of survive longer. For some places like eyebrows, frontal hairline, we need hair follicles that only have one hair coming out of it. A follicular unit can have as many as 1 to 4 or 5 hairs coming out of it. When we encounter a follicular unit that has more than one hair follicle coming out of it, then sometimes we have to split those hair follicles because we need those single ones for areas like the eyebrows or the frontal hairlines. And that takes place under magnification And we're just doing that one by one by one. So, take the hairs out. Here. A follicular unit is grouped either as a single hair coming out, double hair coming out, these are double, triple hairs coming out, these are triple, and then more, but we try not to get a lot of hairs that are four more than that, because we just need for eyebrows, we need single hairs. So that means that I have to sit down and split these and separate them so that I can transplant them. So that's what we're going to do now. After we've gotten all our hair follicles out, we have the numbers appropriately, then we go to the area where we're trying to transplant it. We numb that area, we sterilize the area, and then we use a special size needle to make little tiny holes in the skin in the direction we want the hairs to grow. And then we pick the hair follicles that we grafted and we put them into these pockets that we created. They stay there, they seal with blood, and then they start to grow. Fill it in.
Okay.
Now you can just put your head back this time. You don't need to have your... Come on.
Yeah, sure.
Okay, so just a little bit of that same numbing stuff I gave you earlier, okay? Close your eyes. Close your eyes. Poke. Swelling. Sorry, a little poke. A little bit of a burn. I'm sorry. Fabulous. Turn your head this way a little bit. Good. me know if it gets a little warm, but this way we can just cover all that, keep everything nice and clean and sterile. Okay, I'm going to turn your head just a little bit towards me.
Good.
That's perfect. So what we're going to do now is we're going to make the little holes for where the new hairs are going to go.
And see if we can get you to have a sip or a snack or something.
Thank you.
Well, Dr. Zandifar's mean. He won't let you have a snack.
What's the word? Finicky.
So here's an example of what I mean when I say sometimes you just put a little pressure on it to get it out, and then leave it there.
Yeah, that helps for sure. One of her major concerns was that, is it going to look natural? And of course, that's a realistic concern. We're taking hair from back of the scalp and we're putting it in our eyebrows. So is it going to look natural? And the truth is that it is going to look natural. It's going to be your own hair and it's going to grow and it's going to fill in the spots. Once you're done with the implantation, procedure is done, and the area of the back, the donor side is covered up, patient gets to go home with a dressing over that area for 2 days. That dressing comes off, and the back, the donor area, is easy to take care of. Just cover it up with an antibiotic ointment. You could wash it, and that's it. It will heal within 10 days. You won't even notice anything was done there. And once your hair grows over the next few weeks to months, it will completely be camouflaged. The recipient site, the place where we put the little grafts in, is a little different. We want to be more careful with that. So for the first few days, we're asking our patients to spray saline or salt water that we give them to that site almost every hour. They keep it moist. This allows it to heal. We don't want them to rub or scrub that area. I don't want them to put any kind of a tight-fitting hat or something over the head because we want those hairs to stick and start to grow. So we give you an antibiotic twice a day. Take one today, and then when you go home, in the morning, you gotta keep these nice and moist. So this is a spray bottle that has saline in it. So you can just spray it every hour or so. Keep it moist. Dry out. Yes, that. You don't want to rub or scrub it. Okay. I'll put this in the back for you. You don't want to rub or scrub the area. Okay. And then, here. Your antibiotic, it's doxycycline, 1 tablet twice a day. And I'm going to have Sylvia just give you an appointment tomorrow morning, see you just quickly, make sure you're doing good. I'll take this off, make sure that's healing well. Maybe we apply another one, okay?
Okay. What time?
Let's go up front and I'll have Sylvia give it to you, okay? All right. So look, as a facial plastic surgeon and dealing in cosmetics, a lot of times I'm not curing my patient of cancer or any of those kinds of surgeries that you'd hear about. But what I'm doing is I'm improving their self-confidence and their self-worth and their outlook. I'm making them look the way they feel. And that joy that they have once they come in and say, I love it. That's such a tremendous reward for what I do. I look for that all the time.